17. Legacy impact of the Indian boarding school system. As the federal Indian boarding school system operated for over a century and a half, the department identifies the watershed Running Bear studies, quantitative research based on now adult federal Indian boarding school attendees' medical status that indicate the Indian boarding school system continues to impact the present-day health of Indians who participated in the studies. These results verify the need for a comprehensive examination and report by an independent research group to assess the current impacts that Indian boarding schools have had on American Indians, Alaska Natives, and Native Hawaiians, including health, education, and economic status. A comprehensive analysis of the federal Indian boarding school system will inform future federal Indian law and policy changes in healthcare, education, and economic development. Indian childhood experiences in Indian boarding schools, at a minimum, the separation from family, contributed to poor health impacts on child attendees as adults. The Running Bear studies, funded by the National Institute of Health, are the first medical studies to systematically and quantitatively examine the relationship between American Indian boarding school child attendance and physical health status. The number of physical health conditions diagnosed by a medical doctor and specific chronic health conditions, while also controlling for parental attendance and a large sample. The combined direct and indirect results show American Indians who attended boarding school have lower physical health status than those who did not. Indian boarding school child attendees had a 44% greater count of past year chronic physical health problems as adults compared with adult non-attendees. Now adult attendees were more likely to have cancer, more than 3 times, tuberculosis, more than twice, high cholesterol, 95%, diabetes, 81%, anemia, 61%, arthritis, 60%, and gallbladder disease, 60% than non-attendees. Other studies demonstrate that now adult attendees experience increased risk for PTSD, depression, and unresolved grief. As a result, a prevailing sense of despair, loneliness, and isolation from family and community are often described. Both individual and paternal boarding school attendance are associated with chronic health problems of now adult Indian boarding school attendees. A father's boarding school attendance was independently associated with chronic physical health problems. Participants whose fathers attended Indian boarding school had an average of 36% greater past year chronic physical health problems count than those whose fathers did not attend boarding school. When controlling for maternal and paternal boarding school attendance, only a father's attendance was related to an increased number of past year chronic physical health problems in adulthood, suggesting that a father's Indian boarding school attendance is an independent predictor of his child's adult past year chronic physical health problems. Previous research has noted that American Indian men experienced more physical and sexual abuse in boarding school than women, particularly those more language experienced. The increased trauma that men faced in the Indian boarding school system may have produced increased stress, which then may affect the biological systems of the body. These stressors may then introduce epigenetic alterations that are then transferred to their children, also known as epigenetic inheritance. In the Running Bear studies, American Indian child attendees punished for the use of language and who were also 8 years or older when attendance began reported the lowest physical health status scores. The critical age for learning language is up to 7 and 8, after which there is a steep decline. American Indian children removed from their homes at age 8 or older had a greater degree of language skill and proficiency and may have been more likely to speak their language, leading to punishment. Although similar interaction effects are not found for other boarding school experiences, the studies point to other adverse effects. Now adult attendees with then limited family visits, forced church attendance, and who were prohibited from practicing their culture and traditions had lower physical health status as adults than those who did not have these experiences in boarding school as children. The Running Bear studies reinforced that federal Indian boarding school policies often impacted several generations. The Federal Indian Boarding School Initiative investigation further demonstrates that children of the first attendees of federal Indian boarding schools went on to attend, as did their grandchildren and their great-grandchildren, leading to an intergenerational pattern of cultural and familial disruption, under direct and indirect support by the United States and non-federal entities.